one of HealthSnap's co-founders, and our Chief of Science and Innovation, Dr. Wesley Smith, Ph.D. Wes?
All right, thanks, Sunny. It's great to be here. Let's just jump right into it. And one of the things I like to do in a lot of the courses that I teach in the area of physiology and nutrition and in working with pre-med students is I really like to go back to the father of modern medicine, Hippocrates, and around 450 BC, this quote that was found in, forgive me for forgetting the paper, but I love this quote when I found it, and it relates to what we're going to talk about today. And it's just that all parts of the body which have a function, if used in moderation and exercised in the labors in which each is accustomed, become thereby healthy, well-developed, and age more slowly. But if unused and left idle, they become quickly liable to disease, defective in growth, and age more quickly. And obviously that applies to like our skeletal muscle system, our cardiovascular system, pretty much every physiological system. And it even is related in some ways to our immune system. And we see that today with the eradication of a lot of the bacteria and pathogens that we would be exposed to on a regular basis, our immune system may not be as selective as it would be otherwise, or it's just we see that there's a heightened reaction of our immune system to pathogens that can lead to significant levels of inflammation. We know that people, when they are less active, it affects their immune system in a way that usually causes some immune suppression and low-grade inflammation. I'll talk about that. But so it applies to every physiological system. And I love starting with that because HealthSnap is very much focused on keeping people active, lifestyle, and implementing lifestyle strategies to complement modern medicine. And I think it's a great quote to start with. And like I said, chronic inflammation in immune-compromised persons happens to be very common among individuals who are not physically active. And we're going to start by talking about how physical activity plays a significant role in lowering systemic inflammation and improving the specificity of our immune system and really the effectiveness of our immune system. So we know that chronic inflammation is commonplace across all the major chronic diseases, and I'll give you some examples in a couple slides. But it's also associated with immunosuppression and activation of immunosuppressive cells at the same time. So it's sort of like the immune system, because it's not functioning very well, so we have this sort of heightened kind of overreactive response if our immune system isn't specific enough to recognize pathogens. So if immunosurveillance, for example, is compromised. And in individuals with this condition, they have a high level of inflammatory cytokines, which I like to think of inflammatory cytokines as sort of a flare gun signal sent from immune cells out into circulation to recruit more immune cells over to the area where the problem is, where the pathogen is. And these inflammatory cytokines, when they're in excess, especially, they lead to increased oxidative stress, so free radical damage, which damages tissues and can damage function. It's basically the rusting of the body, if you will, over time. Oxidative stress damages tissues and organs, and it's the function of those organs. Edema, and many other clinical related complications. So it's this elevation in cytokines that's consistent with chronic inflammation that leads to a lot of problems. And where do we see this? Like I said, I was going to go over some of the chronic diseases, but every major chronic disease that is associated with physical inactivity, we know physical inactivity leads to a greater risk of cardiovascular disease, COPD, cancer, dementia, depression. All of these consistently have low-grade chronic inflammation associated with them. So, for example, chronic inflammation will increase the activation of platelets and make it easier for your blood to clot, which obviously increases cardiovascular disease risk. Inflammation also leads to a higher level of adhesion molecules along blood vessel walls. So your blood vessels actually become stickier when you're in a chronically inflamed state, which leads to vascular disease, which can dovetail into issues not just for the heart, but for the brain as well, can be contributing to things like dementia. And then inflammation helps cells to grow through a specific pathway. So a lot like weight training, we want localized inflammation in our muscles to help our muscles grow. Inflammation can turn on signals within cancer cells and increase the rate that they grow and proliferate and replicate. So it increases the risk of cancer. Some cancers more than others, but increases the risk of cancer as well. And then with chronic inflammation, there is a reduced immune cell surveillance, which again increases the risk of cancer and affects our ability to respond properly to pathogens, and increases our susceptibility to cytokine storm, which is one of the things that we see that places individuals with COVID-19 at a greater risk for a more severe infection from COVID-19, having a cytokine storm associated with it. So if there's a great part of this, the great part about it is that through lifestyle, once again, we can improve our immune function, and we can reduce our susceptibility, not just to those diseases, but to the low-grade inflammation that plays a role in those diseases. So with regular exercise, there is an anti-inflammatory state. Think of every single bout of exercise as you taking like a form of aspirin in a sense. Muscles are releasing chemicals into the blood that are anti-inflammatory, and I'll share with you some of those. And there's a neuroendocrine response that happens to be anti-inflammatory. There's also the ability to reduce the risk of the deep hidden fat that's called visceral fat that becomes oxidized. It basically turns rancid back behind our abdominal wall and around our internal organs, and it promotes a lot of systemic inflammation as well. So by reducing that visceral fat or preventing it in the first place, it's another indirect anti-inflammatory effect of being physically active. So it's really interesting as you do a deep dive into how exercise is anti-inflammatory. So let's start with the release of cortisol and adrenaline together. And these are flight or fight hormones. You know, we're through evolution, you could always imagine that stress response, which is a fight or flight response, is supposed to be accompanied by fight or flight. And in modern times, we don't have that anymore, right? So in modern times, stress might result in sitting down on the couch and drinking a beer, but it's not fight or flight. Right? So when we're in a stress response, and we all have stress in us on a daily basis, whether it be good stress or bad stress, we all have stress. And in response to stress, the body is producing a endocrine state, a hormone state, preparing us for fight or flight. And like I said, in modern times, in a sedentary society, we're lacking that fight or flight. So exercise, it can supplant that for us. So exercise can actually be the fight or flight that the body's looking for. So we take and we use the cortisol and adrenaline in a favorable way for our health. So part of this is in response to stress, the cortisol is mobilized it's a glucocorticosteroid. So it's going to increase glucose output from the liver so that we can use that sugar to fuel activity that we're expecting with fight or flight. And at the same time, it's preparing us for any potential injuries we may incur for fight or flight by having an anti-inflammatory effect and reducing the overactivation of the immune system. Cortisol has an ability to improve our immune cells' specificity in being able to identify pathogens and reducing the overactivation of an immune response. That's why steroid hormones that are steroid drugs that are mimicking these glucocortico hormones are anti-inflammatory, like prednisone, for example. They lower inflammation upon taking prednisone. And unlike these drugs that you may have heard of that have obviously some negative side effects, when cortisol is released during exercise, it's an anti-inflammatory hormone. It is being released as part of an internal physiological, homeostatic cycle. So it's unlikely to carry with it as many of the side effects that a pharmacological intervention would. And at the same time, norepinephrine being released acutely from in part the adrenal gland, but mainly from sympathetic neurons throughout the body, is also going to be anti-inflammatory by reducing cytokines associated with endotoxin. So we have both of these hormones in circulation during exercise, lowering inflammation acutely. It's like taking a shot of cortisone, but again, without the side effects that you would expect from using that drug too often. Additionally, and related to exercise as well, but also diet and related to stress management, is the health of our gut. The microbiota plays a significant role with our immune cells. About 75% of our immune cells reside in the mucus-associated lymphoid tissue of the gut. And good gut health comes from exercise, which it's hard to make that link, but when you exercise and you notice that you're getting in better shape and your heart rate gets lower because you have a higher cardiac output, it causes and it's related to an increase in what we call vagal tone, the parasympathetic nervous system, which is the opposite of the flight or fight nervous system. The parasympathetic one facilitates a sort of rest and digest physiological state. So opposed to the fight or flight that our sympathetic division of our autonomic nervous system does, the rest and digest from the parasympathetic nervous system focuses on improved digestion and improved gut health. It actually it helps facilitate better mobility of the gut, greater blood flow through the gut, and a healthier gut. So that whenever you get in better shape and you have more parasympathetic activity, which again, you can see from a lower heart rate, you can also count on it contributing to better gut health at the same time. So stress reduction and exercise, anything that will help increase that vagal tone, that parasympathetic activity, tends to lead to better gut health. In addition to that, a diet high in polyphenols, soluble fibers, fermented foods, those types of things have been associated with better diversity in the gut. And there was a 2020 study showing that in patients with COVID-19, which I figured I would show since we're in the midst of this era right now, that the cytokine storm, the risk of cytokine storm, which is what leads to the most significant events in these patients, happened to correlate very strongly with the diversity of the microbiome of those patients. So in people that had severe COVID-19 susceptibility with those cytokine storms, they tended to have poor gut markers of gut health and less diversity of the microbiome, which again, it tends to suggest the importance of maintaining good gut health, which in part can be performed through regular physical activity. Now, during an acute bout of activity, aside from the hormones that I already mentioned, there are myokines. These are like little muscle hormones that are released into the bloodstream. And one of the most important ones is IL-6. As your muscles are contracting and you're using muscle glycogen, this little metabolite IL-6 is released, and it gives rise to another cytokine that's IL-10. These are anti-inflammatory cytokines. So these are going to reduce inflammation. They're going to reduce those adhesion molecules that I talked about that make your blood vessels stickier. And they're going to reduce the MHC molecules, which our immune cells are looking for to identify pathogens. So it puts us in an anti-inflammatory state acutely during a bout of exercise. It also plays a role in that increase in cortisol, which I just mentioned was anti-inflammatory. So these are little muscular hormones. So the muscle, in a sense, is a type of endocrine gland. And as we use the muscle, we're seeing this systemic lowering of inflammation. I know sometimes people get confused by that because they say, well, when I work out, next day my legs are sore and they're inflamed. We're not talking about the local effects of the muscle damage that exercise might induce. I'm talking about systemically throughout the rest of your body. So if you were to have, let's say you had some inflammation in your shoulder and you were to ride an exercise bike, you would actually notice that the inflammation in your shoulder is decreased after the exercise session because of these circulating anti-inflammatory effects. Another thing that we see is lower expression. In part, it's because of how nitrogen is being shuttled around the body and the role of glutamine. But during an acute bout of exercise and immediately after, we see less cytokines due to lower levels of these major histocompatibility complexes and what are called toll-like receptors on our white blood cells. A major cause of chronic inflammation, which I mentioned at the beginning, was increased deep visceral adipose tissue, not the adipose tissue right underneath the skin, but that around the internal organs and deeper in the body. And during exercise, we find that there are less cytokines being released from those adipose tissue stores, those visceral adipose tissue. And the belief in terms of the mechanism is that during exercise, since muscle's releasing a type of cytokine into the blood, that there's a downregulation and a reduction in the cytokines coming from the adipose tissue and other areas. Sort of like how after exercise, your blood pressure goes down. So like while you're exercising, your blood pressure has to come up. Your central nervous system will allow your blood pressure to come up to perfuse your tissues for exercise, increase cardiac output, increase blood pressure. But then to prevent your blood pressure from getting too high, your central nervous system will then start to inhibit the processes that raise your blood pressure. So as soon as exercise is over, those mechanisms stay in place and your blood pressure is significantly lower for a long time after exercise. Well, that's similar to what we're seeing with exercise and inflammation. During exercise, if the muscle cells are releasing cytokines, then that leads to a reflexive decrease in cytokine release from other areas of the body. And it continues for a pretty long period of time after exercise, depending on which marker you're looking at. So regular exercise keeps these cytokines that are pro-inflammatory lower, and exercising daily can act to lower chronic inflammation overall and the negative side effects associated with it. They've also looked at the type of immune cells that are found within the adipose tissue, and they've actually found in some studies, at least in animal studies, that the type of macrophages are like, these are phagocytic immune cells, and macro means big and phage means eat. So they're like big eaters. They gobble up pathogens, they're phagocytic, large immune cells, and they reside in our adipose tissues and other areas. But during exercise, they find that the actual type of the macrophage can switch phenotype, at least in animal studies, to a form that releases anti-inflammatory cytokines rather than pro-inflammatory cytokines. So even there's some white blood cell changes that occur acutely with a bout of exercise. It's really remarkable when you look at all the effects that happen during one exercise bout. So there's lower circulating pro-inflammatory myocytes as well in humans. So in humans, when they try to see similar things that they find in the animal studies, they find that inactive elderly men and women, so these are sedentary but elderly men and women, have 200% more of these circulating inflammatory monocytes than are found with active elderly men and women, tending to suggest that it exists, and similar findings are found in humans. Another thing about acutely during exercise, so if you go and you exercise today, if you haven't exercised already, these are all things I want you to think about, because it's a lot more fun to think about what's happening in the body while you're exercising. And with every bout of exercise, especially high intensity exercise, there's an increase in the formation of what are called T suppressor cells or T reg cells. And what they do is they suppress an overactive immune response. And that's why intense activity, high intensity like interval training might be really effective at reducing the susceptibility to autoimmune disease because there's an immunosuppressive element. But it's also why we can sort of, if we're thinking of exercise as a drug, and it is, we can see a potential overdose in the drug. So if you exercise too intensely on a daily basis and you're not getting sufficient recovery, you get greater susceptibility to to getting sick. So you've really overdosed on this immunosuppressant, and now you're more likely to get sick. For example, in the weeks following a marathon, there's a significant increased risk the marathon runner has to getting an upper respiratory tract infection. I put this little video together to show kind of where I live is in like a wellness resort area, and we have these fitness classes. And what we see a lot is that people attend these fitness classes and they want to get in really good shape really quick. So they immediately do like intense workout classes every single day without taking a rest between them because they just want to get in shape really quick. Usually it's right after New Year's. So January 1st, this is when this starts. And then by February, let me go back, by February, they're ready to quit because they are pretty banged up and suffering the consequences essentially of overtraining. And what we're looking at on the y-axis here is just a general adaptation, let's say protein accretion, like in your muscles, for example. And what we want to see is over time with exercise, we want to see a gradual improvement in, let's say, lean body mass and muscle growth. But what happens when people overtrain is with every bout of exercise, they're getting the benefits of the exercise. But then if they exercise again too quickly before they've recovered, they can start to see immunosuppression, increased risk of overtraining. They can actually see a loss of muscle mass more than a gain because of cortisol also being a catabolic steroid. And they're basically overdosing on the medication. What we want to make sure is that we use a proper recovery period and a proper exercise intensity, that the adaptations occur more like this. One bout of exercise, you have the recovery phase that's needed to come back up, and what we call this is a super compensation phase, timing the next bout just perfectly so that we get another dip down, and then boom, the next bout of exercise, and we see a progressive improvement in various elements of our health that come from exercise adaptations. In this case, a client will lose weight, they'll lose body fat, and maintain and preserve muscle mass. They'll have more energy, they'll have lower systemic inflammation, greater quality of life. Whereas in the previous example, a person can lose weight, but they actually have an atrophy of their muscles and they have an increase in their body fat percentage. Because if I was to take 5 pounds of muscle off of you, immediately your body fat percentage would go up. So they actually see an increase in their body fat percentage, even though they're losing weight. It's like an overdose of catabolic steroid hormones, as opposed to what we see here, which would be they're losing weight and they're losing body fat percentage because their muscles being preserved and the exercise has been timed properly. So the take-home message here is you think about exercise as a drug, like a physiological form of taking cortisone. You're using it in a way that's properly timed, and you're not abusing it. You're not overdoing it, where you have so much immune suppression that you're now at risk for getting an infection. So the other thing that I mentioned at the top was just reduction of visceral fat. What we're looking at on the right is the HealthSnap app, and we have different things that are measured, including looking at abdominal obesity and risk of metabolic type visceral fat. So you look at a metabolic score and it gives you a rundown of where it is and why the score is what it is. And one of the biggest things we look at is waist to hip ratio and waist circumference, which puts someone at risk for this android obesity, this apple-shaped abdominal obesity, which is likely to be accompanied by visceral fat. Visceral fat is very prone to oxidation. Like I said earlier, it turns rancid, and when it's rancid, it recruits immune cells and increases cytokines, and now you're in a state of chronic inflammation with this centralized obesity that's very dangerous, and that's been associated with making blood vessels stickier and contributing to atherosclerosis. Inflammatory cytokines, they actually inhibit the insulin signaling within muscle tissue, so it affects insulin and leads to insulin resistance, can cause the degeneration of neurons, and can speed up the rate at which cancer cells grow and can increase tumor growth. So all this we see with inactivity, where visceral fat accumulates and leads to a whole host of problems. So we'll maintain a healthy body weight through regular exercise. And in addition to that, as you lose weight through exercise and through dietary change, as fat cells shrink, they release hormones too. So fat cells, like muscle cells, are endocrine glands. We call these adipokines. And one of the really interesting ones, as fat cells atrophy, is adiponectin. When adiponectin is released, it's a COX-2 inhibitor, which is the same mechanism by which NSAIDs like aspirin and ibuprofen work to lower inflammation. So it lowers inflammation a lot like aspirin, but without side effects, because it doesn't have COX-1 related effects on your intestines. So it can lower inflammation through COX-2 inhibition. It lowers cytokines. It also has antioxidant effects to reduce the oxidative stress that occurs in the body during an inflamed state. And one of the markers that we use clinically to look at how much inflammation somebody has is C-reactive protein. And we notice that as adiponectin goes up, C-reactive protein, a marker of inflammation, goes down proportionally. So as you're losing weight, you're also seeing lower systemic inflammation and improved immune function with that as well. Clearly, we're going to talk about nutrition playing a role in addition to activity and weight loss. So we know through physical activity, we have this anti-inflammatory effect that's direct. Through weight loss, especially loss of visceral, centralized fat, we see an anti-inflammatory effect. But we can also significantly contribute to an anti-inflammatory effect through a whole food, especially more plant-based diet, not completely vegan necessarily, but just having a nice wholesome diet full of colorful fruits and vegetables. And a lot of these foods have a COX-2 inhibition like aspirin. Once again, if you think about aspirin, it actually comes from white willow bark extract. So I guess aspirin technically could be considered a phytochemical. But one of the things, again, nice about these foods that act as COX-2 inhibitors, such as carotenoids like lycopene in a tomato, curcumin and resveratrol that we see in things like turmeric or red wine, and then in soy, genistein and epigallocalcicin gallate in green tea, et cetera, these flavonoids, all these have COX-2 inhibition. So they're anti-inflammatory like an NSAID, but they don't have nearly as much COX-1 inhibition. And if you don't, COX-1 and COX-2 are a class of enzymes called cyclooxygenase enzymes. And the COX-1 is really good for us because we need it to produce mucus along our GI tract. And without that protective mucosal lining, we are susceptible to damage to our intestines and ulcers and things. So that's why taking too much NSAIDs could be damaging to your intestines. Well, these act like NSAIDs in that they inhibit COX-2, but they don't have the same level of COX-1 inhibition. So you don't have the negative side effects necessarily to your GI tract that you would in taking a medicine. In addition, we have zoochemicals. So Phytochemicals are plant-based compounds that have these anti-inflammatory and other immunomodulating benefits. But we have zoochemicals, which are beneficial chemicals found in animals. And the polyunsaturated fats, obviously the omega-3s, are important for anti-inflammatory function. So the omega-3s that you would get from fish, for example, or grass-fed meats are powerfully anti-inflammatory and beneficial to include. And in the native app, if you download it from HealthSnap, which is a free app, you can actually see your scores on various areas of nutrition, including the plant-based index, the healthy fat index, the inflammatory index, all predicted from the types of foods that you're consuming. You know, vitamin D is really interesting. I mean, I could spend hours talking about vitamin D, and we only have a limited amount of time as we're finishing up here. But let me just tell you about, just on the surface, what we know about vitamin D. Now, when it was discovered, it was sort of interesting. It was almost like witchcraft. They discovered that children that had rickets from improper bone formation during child development, was that if you were to give them cod liver oil and have them out in the sunlight, that you could cure rickets. And that's how I discovered vitamin D. And we recognize vitamin D playing a role in calcium homeostasis. But, you know, I teach clinical and applied nutrition, and I can tell you that if we had to do it all over again, we would not consider vitamin D a vitamin. We would consider it a hormone that we get from the sun. You know, we're meant to move around on a regular basis, be physically active. We're meant to eat a whole food diet, and we're meant to be outside, because that's where we get our vitamin D. It really is from the sun exposure. The average person, about 20 minutes of sun exposure, which isn't one word, apologize for the typo there, but that's about 4,000 international units of vitamin D from 20 minutes outside during the peak hours. Now, if you have one egg, which we consider a good source of vitamin D, one whole egg is just 40 international units. So you get way more from being outside and being exposed to sunlight than you do from food. And vitamin D has a relatively short half-life. It's not like vitamin A, where if you have a lot of carrots, your skin will turn orange because it sticks with you for a long period of time. Vitamin D has a pretty short half-life. So we're meant to get some sun exposure, a little bit of sun exposure every day. Again, not overdoing it, but just enough every day being outside. And because it's made out of cholesterol, and it's activated in the cholesterol layer of our skin, it gets into cell membranes and it helps immune cells better identify pathogens, which is why deficiency of vitamin D is linked to a greater risk of autoimmune disease. And having adequate amounts of vitamin D seems to improve the surveillance by our immune cells. Our immune cells are better able to recognize antigens. And there's finally a randomized controlled trial that they actually looked at with using vitamin D in patients admitted to the hospital with COVID-19. And they're greatly reduced. I mean, almost shockingly, they have to repeat this. Another group of scientists have to repeat the study because it's almost hard to believe the benefits of vitamin D at preventing the number of patients that went into the ICU. So really important effects on that we see through vitamin D on immune health. Other things that we can include dietary-wise would be magnesium, especially. This is one of the things where people who exercise a lot and sweat a lot may lose a lot of magnesium through their sweat. So people that are really active might need more magnesium. In fact, every time we use the ATP in the body for energy, we're using magnesium as a cofactor. So active people need to make sure that they take in a lot of beans, greens, and seeds, which is where we get our magnesium. And magnesium's role in immunity is really important. It helps us in the generation of antibodies and for the activity of those antibodies. It also helps our lymphocytes, our T cells and B cells, be able to communicate better with our innate immune system, those macrophages that I mentioned earlier. We also have proteins that circulate in our plasma, which complement our immune system. And that system is actually appropriately called the complement system. And it also aids our ability for our immune cells to be able to adhere to this complement system and work together in a way that can protect us from pathogens. So magnesium is definitely something you want to get through the diet, through adequate amounts of greens, beans, and seeds. Zinc, you've probably heard about being important for immune function, and it plays a role in a normal, regulated inflammatory response, as zinc is required by our phagocytic immune cells, like our monocytes, our neutrophils, or our macrophages, for function. So without adequate amounts of zinc, then our innate immune system is going to be slightly compromised. And zinc is also something commonly lost through sweat in people that are really active and out in the heat. Vitamin C is interesting because everyone, when you think about improving your immune health, everyone immediately wants to take vitamin C. The link between vitamin C and immunity is not as clear cut as it is from magnesium and zinc, ironically, because vitamin C is an antioxidant. So we think, obviously antioxidants are very protective, especially when it comes from the oxidative stress associated with inflammation. But vitamin C in our immune cells, in our peroxisomes of our immune cells, actually acts as a pro-oxidant. And by being a pro-oxidant, it helps these immune cells destroy the pathogens that they've gobbled up. So these phagocytic immune cells are better at killing microbes with the function of vitamin C. So that's really one of the main roles it plays. Getting down towards the end here, glutamine and immune function is also very important. Usually if you go to a smoothie shop and you ask for an immune boost, they'll give you some glutamine. And glutamine is really important for the activation of our immune cells and being used for these toll-like receptors. It's also super important in our GI tract. It's important because especially in times of severe metabolic disorders or in terms of catabolic disorders or muscle wasting, glutamine is at times even a conditionally essential amino acid, because when we're losing a lot of tissue, we may not have enough nitrogen to make the glutamine that we need for immune function. So glutamine supplementation would be necessary in that case. But glutamine is another really important one. And it's why in a catabolic state where people, for example, are losing more muscle than they're gaining because they're not eating properly, not recovering properly from exercise, that's another reason why they become immune compromised and susceptible to infection. Elderberry tea has been used for hundreds of years. This has been shown in some randomized controlled trials to reduce the risk and susceptibility to upper respiratory tract infections. And there doesn't seem to be a lot of adverse events associated with it. We just seem to get more immune surveillance with elderberry. That's important. And then one of the last ones that I'll bring up is N-acetylcysteine. We find that in respiratory infections, this very important antioxidant, it functions with the antioxidant enzyme GPX. This seems to be critical in some studies for alleviating symptoms associated with respiratory infection. It also is used as a clinical treatment for liver disease, like for people that overdose on acetaminophen, and it also seems to reverse renal disease. And last but not least is getting adequate sleep. Poor sleep increases that sympathetic activity without the associated exercise, leading to immune suppression. And it has been shown to negatively affect surveillance. It has to do with, just like we said earlier, inadequate recovery. So inadequate sleep also associated with a greater risk of susceptibility and to infection. And it's one of those behaviors that we can measure through scales on our native app. So you can look at stress and sleep and how they are associated with risk of immune dysfunction. So in essence, as we look at the big picture here, we think of like protecting ourselves for, let's say in this era of COVID, we want to make sure that we wear a mask, we want to social distance. All those are important strategies for prevention of getting COVID-19. But we also have to keep in mind that there's a lot of things we can do through our lifestyle to enhance our immune function. And as a general summary, being physically active every day, you can think of it as taking your medicine for lowering inflammation and improving the specificity of your immune cells. So every single bout of exercise, you're releasing anti-inflammatory chemicals and improving the specificity of your immune system, putting you at lower risk for severe infections. At the same time, making sure that you maintain a healthy body weight, and by reducing visceral fat associated with inactivity and a poor diet, you'll see a lower level of immunosuppression and inflammation due to that. And then having a whole food diet loaded with phytochemicals and healthy zoochemicals that we get from quality meats, for example, we can also augment our immune system in a favorable way. And finally, sleep, stress management, and good gut health. All these things can make us more resilient, as well as getting outside from time to time and getting our vitamin D. So there's a lot we can do for our immune function. And what I like to finish with is this quote. I started with a quote, I'll finish with one too. This is from Dr. Dennis Burkitt, a famous oncologist, talking about how we fail to remember in the clinical world at times the importance of prevention. And he states that if people are constantly falling off a dangerous cliff, you could place ambulances under the cliff, or you could put a fence at the top of the cliff. Right now in healthcare, in many ways, we're placing all too many ambulances under the cliff instead of really focusing on that prevention. So thank you for your time, and I'm happy to take some questions related to this.
Thank you so much, Wes, and thank you everyone for submitting your questions. We did go a little bit over, so if you'd like to join us, maybe we'll just answer 1 or 2 questions if that works for everyone. The first one we received is, how do you measure the dangerous fat surrounding the organs since you can't see it in the mirror?
Yeah, that's great. So, you know, subcutaneous fat right underneath the skin that you could pinch and you can measure with things like skin fold. Subcutaneous fat is not associated with increased risk of any chronic disease. Like, you may not want it cosmetically, but in terms of disease, it's not related. So like Sunny mentioned in the question, visceral fat, how do you know you have it? Well, that Android obesity measurement that we use from waist to hip recording, so looking at the waist to hip ratio is one of the ways you could predict it, or just looking at waist circumference in general. So anytime a male has a waist circumference over 40 inches, they have an increased risk of that deep abdominal fat. And anytime a female has a waist circumference over 35 inches, we know that that's a risk. Another way to do it is to take supine abdominal height. If you're laying on your back in the supine position, subcutaneous fat kind of falls off to the side and the visceral fat stays put. So anybody that has between their umbilicus and their spine, when they lay on their back, more than 10 inches, they tend to have a greater risk of that metabolic obesity. And if it's over 12 inches, they're at high risk for metabolic obesity. But that measurement's not done very often, but it's called supine abdominal height.
Great, thank you. And then one more question, if you have time, is will improved immunity keep us from catching the flu, COVID, and other viruses, or just help us to fight them better if we do catch them?
Yeah, so just like I was mentioning there towards the end, things like social distancing, wearing a mask, washing your hands, those are all really important in preventing getting the virus. But what this was more about is having optimizing your immune function through vitamin D and activity and lowering chronic inflammation, reducing the risk of cytokine storm. This is all not necessarily to prevent you from getting a virus like COVID-19, but really preventing you from having a more serious response, more serious infection if you do catch a virus like that. So, I mean, in response to pathogens. So it's really about the severity of the infection rather than preventing it overall.
Great, thank you. So we did have a few more questions. So everyone else who had questions, we will come back to you directly since we went a little over today. But we thank you so much for joining us, and we hope you were able to walk away with some new perspectives and easy to implement healthy lifestyle practices that you can utilize. We'll be sending the recording of this webinar to you shortly. And in the meantime, please feel free to connect with our team on LinkedIn, and stay tuned as we'll be announcing a new series soon. If you're interested in learning more about HealthSnap's remote patient monitoring solution, please visit our website. It's www.healthsnap.io to learn more and to request a platform demo with one of our specialists. With that, again, we'll be following up with you shortly with today's recording, and please feel free to send us any additional questions as they come up. We thank you for joining us today, and we look forward to talking more soon. Have a great day.